Hello, my name is Lena. This is a presentation I have put together as a future midwife, hoping to educate those in my community about looking at birth with a social justice lens. A huge reason we need to do that as a community will be displayed here in this presentation, and a big part of the solution are midwives. I am proud to be a student midwife. However, I do want to acknowledge some very obvious things. I am a white, cis woman. I experience a lot of privilege that others who are not like me do not get. I want to acknowledge that my anti-racism journey is not even close to complete. In fact, I think it is going to be lifelong. It is something that's really important to me. It's one of the reasons that has driven me into midwifery to begin with. And I'm really excited for everyone to take a look, have some fresh eyes, and hopefully by the end of this presentation, move forward with the midwives in our community, with those who are giving birth, with those who have a uterus and can speak, and especially with those of color who are carrying our future. Thank you so much for being with me. Let's begin. So, I want to begin by talking about some stark realities about people giving birth worldwide. In 1987, the maternal mortality death rate, that's what I'm referring to when I say death rate. The death rate was 7.2 deaths per every 100,000 live births. In 2020, the death rate was 23.8 deaths per every 100,000 live births. Just a year later, in 2021, the rate was 32.9 deaths per 100,000 live births. Now, I want to pause for a moment and let that sink in. In just a year, look how fast we jumped. Look how high we jumped. That is not something we should be proud of as Americans, not as birth workers, not as human beings. And this is exactly why I'm standing before you giving this presentation. In 2020, every day, almost 800 women died from preventable causes related to pregnancy and childbirth. A maternal death occurred almost every 2 minutes. Almost 95% of all maternal deaths occurred in low and lower middle income countries. 84% of them could have been prevented. I turned 30 at the end of November. And since the time I have been alive, all of the technologies that we have gotten since my birth. So in 30 years, America, one of the greatest countries in the world, has one of the worst mortality rates worldwide. It is more dangerous to give birth in 2023 than it was 30 years ago. Now for birthers of color, this is not new. This is something they have been experiencing for a very long time, and we will get into that, but I wanted to talk about this first. Black birthers are 3 to 5 times as likely as a white birther to die due to pregnancy and birth-related causes. 3 to 5 times. In fact, a lot of data is showing that it doesn't matter if they are wealthy, healthy, and educated. The outcomes don't change. Preeclampsia and eclampsia, a serious health condition during pregnancy, is one of the leading causes of maternal death among Black birthers and among one of the top reasons for maternal death as a whole. In 2020, the rate of preterm birth among Black birthers was almost 50% higher than white and Hispanic birthers. The maternal mortality rate for 2021, again, I want to remind you, was 32.9 deaths per 100,000 live births. Black birthers' death rate in 2021 was 69.9 deaths per 100,000 live births. The United States, kind of true. The United States ranks 23rd in infant and maternal mortality among developed nations. If we were to look at only Black birthers in the United States, we would see that we rank in last place, ranking behind Costa Rica and Mexico. In my head. For every one maternal death, there are 70 near misses. For Black birthers, they experience these near misses at 2 times the rate, more than any other race or any other ethnicity. Again, we're going to talk about how we got here, why we're here to begin with. But this is exactly where we are today, and why everything I'm talking about in this presentation is really important. So, the history of midwifery is long and rich and sad and horrific and beautiful and all of the things. And I couldn't possibly put the history of midwifery in its entirety in a small presentation. So I honestly just picked out a few things that I thought were really important and that stood out to me during my history class. However, again, I plan to add on to this presentation. So eventually I will have an entire timeline, and we will come back and discuss all of the ins and outs of midwifery history. And believe me, you're going to be shocked as we go along. Now, midwifery is arguably the oldest profession in the world. We can trace it back to 1500 BC when midwives are mentioned in the Bible. And believe me, if you haven't read the Bible, they're the good guys. So in 1654, we can go that far back as far back as 1654 and see that enslaved African American women were already being beaten and tortured. They were having inhumane abuses on their bodies, their families, their reproductive rights, and essentially all of the medical advances that we have, maybe not all of them, but most of them, we can thank Black birthers for, because everything we know about birth and midwifery all came from them. In the 1800s, men began to take birth over. They thought it was time for them to step on in. And during this time, there was a huge crisis with what they called childbed fever. And guess what, folks? It was caused by poor hand washing. Had these men have listened to the midwives, they would have understood that basic hand washing can save lives. By the late 1800s, for profit, hospitals were created. They were perceived as a luxury set apart for white birthers. Many of the obstetric advances from this time period came because Black birthers were being experimented on, having procedures perfected for the white birthers at the expense of Black bodies and their babies. This was done without pain medication and consent. Now, as someone who has had 2 IUDs, several uterine biopsies, egg retrievals, taken lots of shots for frozen embryo transfers, I can tell you that doing all of these things without pain medication is excruciatingly painful. And that's just on my physical body. What it did to my mental and emotional health is a whole other story. So I cannot begin to comprehend what it was like for these people giving birth at this time. Continuing on in the late 1800s, Black birthers, immigrants, poor families, they were only tools in white people's hands to defame midwifery. They were making it out to be as if midwives were unintelligible, dirty, dangerous, and they really made everyone at this time, white people, believe that it was more dangerous to give birth with a midwife than it was with an OB. I want to point out that 1930 to 1960, there's a huge chunk of literature that supported that birth with the midwife is safe, if not as safe, safer, if not as safe as birth in a hospital. Anyway, we are still dealing from the repercussions of what has happened during this time frame when men came in, white men in particular, and pushed all of the Black midwives out. They took away all of their culture, all of their wisdom. And honestly, these people did not see themselves as being professionals, which is something I very proudly say now, because midwifery has a very different lens than it did at this time. But they were just seeing themselves as saving lives and doing the work. They knew how to do birth right. They knew how to do it, including their cultural practices, their religious beliefs. They were doing it from a very close-knit community base. It is really important when we look at this lens that people giving birth with midwives were safer because midwives are really skilled and very wise. However, what matters most is that the majority of the people giving birth with midwives at this time were in rural areas where most Black people were. So midwives were really crucial to saving and succoring the lives of these Black families in the community. And these Black families trusted these midwives. They looked like them. They had experiences that they could commiserate on, if not 100% share a story about together. So this was a lot more close to what they would prefer, what they deserve, what would have been ancestrally. However, they were not getting the care and the love and the respect that they deserve. And trust me, neither were the Black midwives. As we move on to the 1900s, between the 1915 and 1930, there became um, this guy. I don't like this guy. He kind of started a little bit of a fuss. Dr. Joseph DeLee published a paper in the Association for Study of Prevention of Infant Mortality. Now, I do want to pause right there because that sounds so legit. And during this time, if you don't know anything about childbirth or medical crap or how to like dissect a study, like, holy cow, I can totally understand why people maybe would absolutely believe this guy. I mean, he's a white doctor, right? Anyway, this guy believed that birth was a pathological issue and it needed to be tended to basically 24/7. He believed that midwives had no place in childbirth whatsoever. He believed that they were actually dangerous. By 1918, the United States was number 17 out of 20 nations in mortality rate. Let that sink in. 1918. Folks, we have never been in a place of healthy mortality rates. I've heard it be said that the way to determine a healthy population is looking at their infant and maternal mortality. Well, we can let that speak for itself, can it? Anyway, so these rates, obviously terrible, 17 out of 20, believing that poor outcomes would continue until there was a full medicalization of pregnancy and birth. And may I mention a complete departure from midwives and all that came with them, that wisdom, that culture, that inherent understanding that us white folks will literally never have. Suddenly, they become necessary and enter the granny midwives or the grand midwives, Black midwives. Now, mind you, these were skilled, smart, intelligent people. However, they were suddenly needed, but with the lens that it was a necessary evil, that using these midwives is better than having all of these white people go without care, heaven forbid, until they can fully medicalize pregnancy and birth and whitewash midwifery so they can offer classes to white women who may want to be midwives. By 1935, midwives attended 10% of births, and of those 10%, only 4.5% of them were white birthers. Again, like I mentioned, most of the births at this time that midwives were attending were in those rural areas where Black families were living. Enter in the hippie area, which is how most people see midwifery today. A lot of people like to joke with me about being a hippie midwife witch, and a lot of them don't even realize how true to history that actually is. We don't have time to get there today, but we will at some point. So here we are in the 1960s, 1970s, and nursing is becoming a respected profession for white women, particularly, to enter into. Many nursing programs were sprouting up all over the country. In fact, I remember when I chose to apply for school here at Midwives College of Utah, my father, who is in his 60s, he comes from that time, he told me that I should go for nursing instead. And when I explained that there is a certified nurse midwife route, but that is not the route I felt I needed to take, he couldn't quite comprehend. In his mind at that time, we've gotten a little bit better, but in his mind at that time, a midwife isn't someone who's necessary in pregnancy and birth. So why would I go for that? I would likely have more experience with pregnant people and their babies as a nurse, right? Nah. Again, we'll get to there, not today. By 1960, 97% of births were taking place in the hospital, and this is not much different today. I believe I've seen stats between 98 and 99%, so I believe it's probably somewhere still in this realm. But the majority of births today are still taking place in the hospital. I believe about 2% of them are taking place with midwives. Nurse midwives gained a respected certification in the 70s. So there were a lot of white women who saw the benefits of natural childbirth. This is what I mean when I mentioned below that the feminist movement came in, largely focused on white women and turned people's heads to an unmedicated birth. And it kind of began to revive the lay midwifery standard, but it definitely looked different. Like I mentioned, it looks a lot more hippie right now. Um, By 1973, midwife attendant births were at their lowest point, forcing out the few remaining midwives who had held on to all of that culture and wisdom that had been brought here from all of these Black people and appropriated and completely mixed up and disregarded. All of a sudden, here we are. Uh, this is a picture, as you can see, of Ina May Gaskin. Unfortunately, Ina May is who I was introduced to when it came to like big midwives in the birthing culture. And she is very well known for being that hippie midwife. As you can see, look at all the people who have been on the farm giving birth to those babies. Don't get me wrong, she has done respectable work there, but there's a lot of racism and implicit bias, whitewashing, a lot of issues with Ina May Gaskin. And a lot of that is because she has appropriated all of this culture. And again, get to it. In 1979, the FDA expressed concern about side effects of mothers and babies who had large doses of anesthesia. As we know, hospitals are the only place things like Demerol, which is the particular drug we talked about in class, um, that's the only place people who are giving birth are receiving Demerol. As a matter of fact, as a doula, I've had clients take Demerol right through their IV. Similar concerns about things such as epidurals, Pitocin, Cytotec, all of those things were also being brought about. A lot of questions regarding side effects, acute and long term. As we know, there's a lot of very dangerous side effects with epidurals, Pitocin. Um, One of the exciting things that I've been able to learn and understand as a midwife is how important the very natural hormone cycle that helps labor and birth progress is. And one of the most important things is keeping it on its course on its own. The moment we insert something synthetic, something that interrupts that natural, fragile, cohesive hormonal cycle, everything comes to a screeching halt and it changes the way the body is able to birth. And the body knows exactly what it's doing without all of these medications. And a lot of these medications are causing unnecessary interventions that are more dangerous than a vaginal birth, such as a cesarean. Again, the US has a history of using medications on pregnant people that can be concerning. Some of them have done a lot more harm than they have good, but thalidomide and Cytotec are one of them. Cytotec is well known for causing uterine rupture. On the label, it says not for not for use with pregnant people. Against label warning, used anyway. Um, Thalidomide, thalidomide was a drug that was introduced that gave thousands of babies horrific birth defects and caused a lot of issues. At the end of this presentation, I will list some resources so everyone can kind of dive deeper into some of the things I've mentioned. Because again, I plan to add to this presentation, but we don't have all the time to get into all the nitty gritty. So kind of keep that in the back of your head as we go along. Many C-sections can be avoided if medical intervention only took place when it's necessary, not when just convenient. The US has about a 33% C-section rate. Last I looked, it was about there. Mind you, these rates can look different in areas. We could have an area in the United States, such as down south in Arkansas, Alabama. Those are some of the most dangerous places to birth, where their death rate could look 4 or 5 times, 6 times, 10 times as high as the United States does for Black birthers just in that small community alone. Remember, Black people make up only about 13% of our community, yet they are experiencing massive, massive disproportionate outcomes for no reason other than racism, and that is something we can change. Parents began to look into home birth at this time. They were concerned about the drugs too. Nobody really knew. All of us can probably commiserate on some level when the COVID vaccine came out. We weren't sure what to think or do. Early stages of COVID, we had no idea what the severity, long-term effects, we still don't know of COVID. So parents at this time, when they're hearing about these concerns and these medications, they began to feel a little bit more refreshed and rejuvenated and go back to the natural childbirth way. Medicaid comes along, and now physicians decided that they were happy to take on the clients who previously were pushed to the side. And the reason they were doing that is because Medicaid was going to bring in a little bit of money. Now, I do want to mention that Medicaid has a lot of problems in its of itself and still is not giving these people the adequate care that they need. And let's not get it twisted. This is also interfering with white people and their babies too. Let's not get it twisted. It's just happening a lot more to our Black brothers and sisters and their families, and we need to focus on them, and we need to take care of them. Now, there are a lot of things that I have scrunched into this 20-ish minute presentation, and the biggest part of it is going back to where we are right now, today in 2023, with a horrible maternal mortality rate in the United States, with very preventable deaths that we, as Americans and as physicians and birth workers, that is something we need to be concerned about. Now, I'm going to, like I said, list a lot of resources along with my references for people to educate themselves. Many folks have already put in the emotional labor for you to go to YouTube or a book or a podcast or whatever and educate yourself on systemic racism, educate yourself on implicit bias, medical racism. I have amazing books in particular that I can recommend about obstetric care and the history of how it came to be, a lot more in depth than what we talked about today. All of it comes to play here today because we are living in a country with very exclusive healthcare. Again, I am a white cis female. I was lucky enough to do IVF with 2 cycles. I'm lucky enough to be able to pay to freeze my embryos. I'm not lucky, I'm privileged. We still struggle financially. We still experience hardships. But I have never thought that I could potentially get pregnant and give birth and die because my provider was racist. So I want that to sink in as you reflect on the things we talked about in this presentation. Now, before I end, I did want to say that, again, these are things we can change. There are things we can actively do today, aside from educating ourselves, aside from using our voices to be loud and rage, and again, purposeful rage. We don't want an insurrection, but we do want to take that rage and put it towards change right now today. So if you're asking yourself, how the hell can I make a difference? I'm going to tell you. There are several ways that you can get involved and potentially encourage laws that would greatly, greatly change the lives of Black birthers. I am going to read this from a source that I will link in a couple slides over, but this is from Birthing Justice, and they just put out a documentary yesterday or the day before that was amazing. I saw a 25-minute clip about a week before, and then I watched the whole entire documentary as I was putting together this presentation and thinking a lot about how I wanted to present myself while I gave it. And I learned so much from it, and it lit that fire right back up as if it ever went away. And so I am reading from a resource guide that is available in the resources that I will list below. It is important to discuss legislative solutions for our nation's Black maternal health crisis. This is a crisis, folks. If you didn't gather that from all of the information we have discussed, I want you to really sit with that and ask yourself, what am I missing? Why isn't this sticking? For example, members of Congress have been considering a 12-month postpartum Medicaid coverage package. that would offer significant support to low-income Black mothers. Now, I can tell you, as a birth worker, as a prenatal massage therapist, I would love nothing more than to see postpartum be paid for, to have these families have time to heal, connect, rearrange, and adjust because their lives are completely flipped upside down. And giving birth is no easy feat. We should have way more than 6 weeks to get back on our feet. And we should not have to force ourselves out by 6 weeks because we want to keep food on a table and a roof over our heads. That's not the way we should be living. We live in such an exclusive healthcare system. We require law changes. We require funding for more Black midwives. And we need a more diverse availability of providers to take care of these people. Like I've said a few times in this entire presentation, I will never understand as a white person what it is like to carry the ancestral trauma, the daily trauma and stressors, and all of these fears every single day just because they are Black. I will never understand it. But you know who will? A Black midwife. And we are severely lacking in them. And that is a whole other thing in and of itself, but I'm hoping that you can see how all of this ties in. Along with this 12-month postpartum period that they are considering adding to the Medicaid program, there is a Black Maternal Health Momnibus Act, and this would provide essential coverage for Black birthing people. So this would allow people to get to and from prenatal visits. This would allow people to get education, to get support, things that are needed for everybody who is pregnant. If you are sitting there saying that you are pro-life, I want you to consider how necessary it is that these people have transportation that is reliable, affordable, and safe for them to get to and from. They need education, they need support. You and I are no different. They need that too. They don't have access to that. And this would allow them to have that access. These are simple solutions to a massive problem, and all of us can do something about it. When it comes to finding systemic solutions, we, Birthing Justice, believe that government plays a role. In addition to federal policies, there may also be a logical legislation on the books in your state to address this crisis. So we encourage you to reach out to the following advocacy groups and get involved. And below I will list several that you can reach out to, along with resources that I have loved and learned from that you can love and learn from as well. Now, this was a really heavy topic, but as you can tell, it's something that is really important to me, and it should be important to you. It is important for the future babies that are coming into this world. We as women, we as human beings, deserve inclusive care. These people deserve to have a plethora of providers of color that they can reach out to for various health concerns and whatever it is, and we are extremely lacking. I could go on forever, but thank you for hanging in there with this crazy presentation. Thank you for listening to me. I'm hoping that I can do this topic some justice as I present it for the very first time, and I look forward to the rest of my anti-racism journey, lifelong journey, as I said, because this is something I really want to work on, and it's something that I would love for the community within where I live here in my little Midvale, Utah area, something I would really love for them to come along with me. Anyway, thank you so much.